Hello, everyone, and this is a special episode of Beyond Surviving to Thriving, Look Better, Feel Better, Be Better by kicking MS and other autoimmunity in the butt. As everyone knows, we are going through just a crazy time right now, and with the COVID curveball that's been thrown our way, there are a lot of concerns that have been coming forward. There's been a lot of misinformation that is being put out there, and today we get to have a mythbuster on with us to make sure that we're not getting the wrong information, to make sure that we're doing everything possible to take care of ourselves in the best way that we can. So I am so happy, so honored, so pleased to be able to welcome to the show today, Dr. Rishi Desai. He is, one of the reasons I was really happy that we were able to bring him on is because he is formerly with the CDC. And, you know, when you are going to talk about infectious diseases and things like what's going on with COVID and the virus, we want to have somebody who's got the right information. We don't want to go to somebody who's just talking to be talking. We want somebody who actually has something to say that's going to inform us about what we can do to take care of ourselves and keep ourselves safe. So Dr. Desai, thank you so much for being on today and welcome.
Thank you for inviting me, Yvette. It was very kind of you.
Thank you. Okay, so I want us to just jump right in. One of the things that is different about this coronavirus, they're calling it a novel coronavirus, because we haven't seen this exact strain before, which means that we don't have any defenses against it. Can you tell us a little bit about what the disease actually does to us? Why is it affecting so many people and so harshly that we can't do anything about it right now?
Yeah, absolutely. So coronaviruses are a group or a family of viruses that circulate in our population normally. And about a quarter, 25% of all common cold illnesses are from coronaviruses. And so let's say a year ago or 2 years ago, if you had the common cold, there's a quarter of a chance or 1 in 4 chance that it was from a coronavirus. The reason this is novel is that unlike most coronaviruses that get into your nose or your mouth or your eyes and kind of linger in the upper respiratory airways and cause, like I said, the common cold, this one has that as its first base, but then it kind of goes deeper into the lungs. And I actually have a bit of a cough right now. That's me modeling how to cough in my elbow. But basically it goes in your lungs. And then in some folks, it actually goes even further. It actually crosses into the blood. When it does that, it's called viremia, or you can say a person is viremic. Emic just means something in the blood, in this case, virus. So those are the 3 stages, the upper airways, the lower airways, and then virus in the blood. And the symptoms you get sort of go with that. So initially, it'll cause very common cold type symptoms, you know, runny nose, sore throat, congestion. It's been very well reported now, lack of smell and taste, things like that. As it gets deeper down, it's going to cause that dry cough, shortness of breath in some people. If it lingers for long enough, maybe even chest pain. And then once it gets into the blood, it's going to cause other symptoms, things like, you know, fevers, fatigue, malaise, lethargy, you know, depending on how severe it gets. So that's essentially the overview of what's happening with COVID-19 and how it's a little different than the other coronaviruses that we have seen or are immune to over the years.
So one of the I think things that impressed me about it from the very beginning, I've had pneumonia twice, and after having it the second time, I developed asthma. And so somebody who already has a sensitive respiratory system, you know, even if you're not in the normal sensitive population, how is that impacting them?
It's a great question. And actually, it refers to this idea of lung function. So let's say my hands represent kind of 100% lung function. Now let's say I have lung cancer, or let's say I have lung cancer plus I have congestive heart failure. You can see my lung function is decreasing, right? And so with COVID-19, let's say it takes a hit to your lungs or causes your lungs to take a hit down to here. Well, if I'm young and healthy and I have no other issues at all, I might be okay with that. That may not cause any significant problems. It might lead to things like pulmonary fibrosis, which is kind of a long-term chronic illness. But in the sense that I might survive that just fine. Another person that starts here with lung function right here, they take a hit and now they're down to 0. So that's the difference, is that how much you start out with, how much pulmonary function you start out with, really predicts in a very strong way what you're going to have in terms of your disease course. In terms of sensitivity, which you brought up with asthma, one of the things we know about asthma is that there are viruses and bacteria even that can set you up for developing asthma, or if you have some asthma, it can worsen that, cause an exacerbation of that. So those are things that kind of happen in addition to having COVID-19, is it could trigger other things, like you just said, asthma.
So you mentioned chronic conditions, and my audience is these are people with autoimmune diseases. So I have multiple sclerosis in addition to the lovely asthma. And so, for not everyone who has MS takes, is on a disease modifying therapy. And there are lots of different types of disease modifying therapies out there. The one that I'm on, and that a lot of other people are on, is an immunosuppressive type of DMT. And so one of the things that I want to make sure I'm understanding is how our immune systems work when we're suppressing it anyway, and then something like COVID-19 comes along. What are we supposed to do? Like, how is that, they tell us that we're higher risk, and some people are saying, no, you're not any more susceptible than anyone else is. But I find that difficult to believe because, right after infusion day, they let us know you're going to be a little bit more susceptible to things like upper respiratory tract infections and stuff like that. So with something as devastating as COVID-19, it seems to me that this would be something else that we should probably be watching out for.
Yeah, it's a great point. And the immune system is a very complicated thing. It's a beautiful thing, and it keeps us safe. But to break it down in some simple terms, there are B cells, there are T cells, there's your innate immunity versus your adaptive immunity. There are lots of different parts that are moving. And whenever you take a medication, like you mentioned, you take some medications that are immunosuppressive, the question to ask is, what part of that symphony, if you will, is really being shut down? Is it the violins? Is it the cellos? Like, what part of that is really shutting down, and for how long, and how effective is that shutdown? And those medications are in many ways life-saving for folks that have these conditions. And when you have something like COVID-19 come into your body, you want that entire symphony working. Ideally, you want every part of that working, because that's going to help clear the infection. Now, the virus does, as I mentioned, hit the mucosa, right? It hits the back of the throat. It's called the mucosa. That mucosal lining has a lot of parts to it that immediately attack the virus and kind of ward it off. Now, if you have a blocker because of a medication or because of some other issue that you might have, that blocker is not there, the virus is coming in and making a residence for itself. So you certainly, in general, if you have an immunosuppressive medication or if you're immunocompromised for another reason, you are a setup for these viruses. And the degree to which you're a setup really depends on what medication you're taking or what condition you have.
So if you're within the autoimmune system or within your immune system, which part of it is COVID itself most affecting? So you mentioned B cells, T cells, right? Which part do we have to be concerned about?
So a number of different cells are coming together to help ward off the infection. Very specifically, because it's mucosa, it's going to involve things like antibody, eventually, like IgA, which is an antibody that's lining the mucosa and trying to get rid of virus eventually that's there. Initially, though, it's your innate immune response. It's the cells that are there, just kind of sampling, seeing what's going on, always checking. I think of them as kind of the police officers of your body, always kind of controlling, picking up new pathogens that may be coming their way, and then alerting the adaptive immune response to say, hey, there's something unusual going on here, you might want to respond. So when you have anybody with a blocker with their innate immune response or even their adaptive immune response, that really sets them up again for getting more severe disease from COVID-19.
Okay. So I'm not going to ask you to be a prognosticator. Well, actually, I am a little bit. So there's been a talk that sometime in the fall, there's the likelihood that there will be a resurgence, right? So there's the expectation that we're going to flatten the curve, and we're going to see a lessening, not just of the deaths that are occurring, but the actual, just getting the disease, that's going to go down at some point, right? And I was listening to one of the doctors who was talking, and he was saying that at this point in time, there is not an opportunity for sort of the herd protection that can happen in communities when there is a sustained exposure, like over a lengthy period of time, right? So this has come really hard and really fast, and we don't have that right now. But when it flattens some and we see the reduction in the numbers across the board, is there going to be a resurgence? What is the likelihood of that, and why would that happen in the fall?
It's a good question. And I kind of sense a few questions in that one question. One is about herd immunity, and I'll set that aside for just a moment. Another is about resurgence. You know, America is one country, and we're dealing with this as a nation right now. Every country around the world is dealing with this as well, and each country is on a different trajectory. So right now, we're noticing, even within our one country, New York is on a different trajectory, for example, than California versus Florida. And all these trajectories, what they mean is that you're going to see kind of a peak, and then ideally a drop off in terms of number of cases. Let's take the example of China. China had a huge peak, and right now the majority of the cases in China are importations from other countries. So they're getting now COVID-19 mostly from travelers that are coming in, and they have a setup for that in terms of quarantine and things like that. You could imagine a scenario where New York goes through the worst of it, they scale up their efforts, and instead of having travel restrictions on residents from New York going to other areas, which is something that has already happened, the reverse might happen. And they might say, well, you know what, actually New York's gone through the worst of it, let's say a few months from now, and now they're seeing fewer cases in New York than actually visitors coming from other states. The same thing happens at a national level. We might say, well, actually America's gone through the worst of it at some point, and now we're seeing cases coming in from other countries. So that's the most likely source of resurgence, is the fact that we have a lot of travel globally and a lot of movement around the world. And so that means cases from different countries are going to keep coming in, and we're going to send cases out, things like that. Having said that, once you get this much disease in a country and around the world, the virus has taken hold. And so you're going to see some areas where it's going to resurge even domestically. And so that's another part of it as well.
So let's talk about New York and California. I live in California. I have friends in New York. And what they're seeing is so, they are taking really aggressive actions to get control of this. And I look at the short term and the long term, right? So you look at the numbers and you're going, wow, it's crushing, the spirit is being crushed by just the feeling of impotence at being able to get control of something that you can't even see, right? And here in California, while it may be a little inconvenient that we're, sheltering in place and taking all of these steps, but our numbers are so different. So in between California and New York are all of these states who are taking these different approaches, right? And I think I'm concerned with, where does it all meet up? Like, where do we have the balance?
I think the two key variables you want to look at is how much disease burden there is in a state and how aggressive is that state. So let's take the example of New York and California. Both governors, I believe on the same day, declared a stay in place kind of order. And that means that they were both very aggressive or equally aggressive, at least on some level. I would say that the level of concern in California has been relatively high. The level of New York has been relatively high as well. So both states have been very aggressive. Both governors have been very proactive. And so in a sense, I like using those two as a comparison. That's the response. But then the other half of it is how much disease burden is there. And New York, on that day that we both made that same step or took that same step, they had much more disease. And this is a logarithmic growth, right? So every day, let's just take the number 1, let's say it multiplies to 10, multiplies to 100, to 1,000. That's not the growth of this virus, but that gives you a similar analogy. If we start with 1 case and they start with 1,000, that's a 3-day difference using my little example. We would get there in 3 days. But if we start with those same bases and then have the same response, we're going to have a much better outcome because we only had 1 and they had 1,000 already. So what happened is that we took the same response, but they were a few days, maybe even more than just a few days ahead of California. And so now we see that playing out because they're completely overwhelmed right now. And we're actually in California doing well enough to donate ventilators to some of those hard-hit areas.
I did see that. I was really excited about that. So I want to just circle us back around a little bit to autoimmunity and the way people are coping with the disease. And one of the things that I wanted to just bring up quickly is I have a niece, an aunt, and a few other family members who have lupus. And, there has been sort of a run on the drug for lupus that's used to treat that. That can you just, I can express my opinion, but I'd rather have yours. Where are we with that? And why should people not be taking that into their own hand?
Yeah, is the drug you're referring to hydroxychloroquine?
Yes.
Yeah. So hydroxychloroquine was researched, and there was a study put out about how in a handful of individuals, it looked like hydroxychloroquine plus azithromycin, which is an antibiotic, together seemed to reduce the viral load in roughly 6 days. That was a very small number of individuals, but the fact is it got published and there was a lot of hope around that medication combination, especially because there's this notion that these drugs have been around for a while, they're essentially safe. And so when that happened, a lot of folks started to make a run on the drug, went out and bought the drug or purchased the drug however they could. And what that did is that made a shortage for the people that absolutely need the drug for other indications that are well documented and well researched, like you just mentioned. So now there's another study out on hydroxychloroquine, just came out. It's a few more patients than the first one. Both are roughly handfuls. The second study shows that it actually is not that effective with COVID-19, and it caused some cardiac toxicity or heart toxicity in one patient. One of the patients in the study died. And so there is concern now that maybe it's not that effective as indicated by the first study, or maybe the promise isn't there. What you do in these situations is you try to answer the question in a much more rigorous way, a randomized controlled trial. And that's what's actually happening now. They're trying to figure out really what is the truth around hydroxychloroquine and azithromycin in the context of COVID-19. Is it a useful combination or is it not? And in the absence of that data, it's really unwise to go out and purchase it or use it because we're seeing toxicity from it already. And the core edict is, of course, first do no harm. And in doing that, you're doing a lot of harm to the people that actually need the medication.
Plus, we need to wait until, I just felt like the results weren't statistically significant because there wasn't a big enough sample size to make that leap. And so it's concerning that people are going to try, and I've seen people who are trying to self-medicate, right? And taking derivatives of hydroxychloroquine and it not having good results. So that's a little bit concerning too. So when you have people who have autoimmune conditions, what is the best advice that you can give for staying safe and for minimizing, we have the broad-based recommendations, but specifically for autoimmune conditions, when people are trying to live their best lives and they're cut off from the other maybe alternative therapies that they normally do to help with the living, right? So usually massage is amazing, and now you can't go to a massage therapist or to your acupuncturist or chiropractor or whatever. So what are some recommendations that you can make for people who are already living with a disease like this and then have to worry about the possibility of contracting the virus?
It's a hard question. And one of the reasons is that I think folks that live with chronic illness, such as autoimmune conditions, are always in a tough position because they're always juggling their condition with the life that they want to lead. And one thing that I think the whole world can learn from this particular group is that you're not defined by your illness, you're defined by your wellness, the things that you can do. And right now as a society, I think a lot of people that don't usually think that way are grappling with that. They feel stuck at home. Well, why don't you twist it around? What can you do at home that you otherwise didn't have time to do at home? So kind of constantly redefining your situation in terms of what you can do versus what you can't do. With massage therapy, for example, that's obviously very helpful. And I can tell you that I can only imagine how frustrating it must feel to not be able to get these therapies that are not just nice to haves, but in many cases need to haves. Mm-hmm. And out of desperation, what I've come to realize in the last few weeks is that I've seen an incredible number of creative solutions, solutions that would have otherwise never proposed themselves had we not looked for them. One simple solution, this is one that's used for pain mitigation in general, but let's say pain is one of the symptoms that you're trying to alleviate. There are lots of visualization techniques out there, and you can go online and learn how to do visualization or biofeedback. And that's something that you could do yourself. And there might be someone out there that never tried that or never wanted to try that because they already had their own kind of set of tools in their toolbox. Well, this is a new one. And this might be a good time to learn this one so that when life does get back to normal, now you've got one more tool that had COVID-19 never happened, you would have never taken the time to learn. So I think that there are opportunities to figure out new strategies. And to be honest, the best way to do that is to bring people together and have discussions and say, hey, what worked for you? What worked for me? Or what are you trying? But I've never been as impressed with the human spirit and creativity as I have been in the recent weeks. And I think that the MS community and the autoimmune community in general is so good at being resourceful that I imagine that they probably have a lot of collective solutions that I wouldn't be able to propose, but I imagine would come from that group.
I just want to say thank you so much for being with us here today and for giving us so much great information and for clarifying so many things, because I think that when you have misinformation and you start making mistakes, it can damage you physically, and if it's bad enough, it can cost lives. So thank you for clarifying some things for us and for giving us some things that we can look forward to as far as our wellness. I love that because I am a health and wellness coach. So that was great. But thank you again for being with us today.
Yeah, it was very kind of you to take the time to reach out and invite me to your program. So thank you.
All right, guys, that's it for this episode. We will continue to put out some special editions of Beyond Surviving to Thriving so that you can live better despite the COVID curveball. Have a great day.